Hello, great nurses. Welcome to the nursing career pathway, where we guide nurses on their pathway to success. Here's your career coach. In the initial module, we discuss how physics principle relates to nursing practice. Here in module 2, we'll be discussing molecular phenomena and their applications to nursing practice. So let's dive in. There are circles to success, as we know. Red circles indicate that this area must be known for your next examination. Orange circles indicate that these areas are good for clinicals, and green circles indicate that these areas should be skimmed later. Specific objectives for module 2 are as follows: to define the following atom, molecule, matter. 2. State common examples of molecular phenomena. 3. Describe the states of matter. 4. Explain the concept of the following: surface tension, osmosis, and capillarity. Active transport, and then diffusion. 5 objectives is discuss the application of the following to nursing: surface tension, osmosis, capillarity, active transport, and diffusion. So let's begin with objective 1. It says to define atom, molecule, and matter. So we all know this. What is an atom? An atom is the smallest indivisible unit of an element that retains its chemical identity, composed of proton, positive, neutral, and electrons, which is negative. How does it relate to nursing? Atoms form the basic of all chemical reactions in the body. Example is oxygen atoms in respiration. Molecule is defined as 2 or more atoms chemically bonded together. Example is water. Water is made up of 2 molecules of hydrogen and 1 molecule of oxygen. Oxygen is made up of 2 molecules of oxygen, that's the oxygen gas, and carbon dioxide is made up of 1 molecule of carbon and 2 molecules of oxygen. How does this relate to nursing? All drugs, nutrients, and body components such as protein, fats, and carbohydrates are all made of molecules. Next one is matter. Matter is anything that has mass and occupies space. How does this relate to nursing? Medicine, IV fluid, gases such as oxygen and nitrous oxide, and even the human body are all forms of matter. Let's look at a way of summarizing. Atoms, they are the smallest unit of matter with mass, occupying space, and exhibiting kinetic energy. Example: vibration of solids and the moving freely in gases. Atoms are mass particles in motion. In IV fluid, sodium atoms move via kinetic energy to maintain osmotic pressure, a physical principle critical for fluid balance. We look at molecule. Is a group of atoms bonded by electromagnetic force, possessing mass and kinetic energy. For example, your oxygen molecule moving at 500 meters per second in the air is an example of molecules. Molecules are energy carriers, such as oxygen. Oxygen molecules diffuse into the blood due to kinetic motion, not chemical attraction. This explains gas exchange physics in alveoli. So in the alveoli, movement of molecules such as the oxygen is an example of how gases diffuse. Next is matter. Anything with mass and volume existing in the state defined by particle motion. Solid vibrates while liquid slides, and gases has a kind of chaotic movement. Blood is liquid matter. Its flow depends on viscosity. That's physics, not chemistry. High viscosity, for example dehydration, will lead to resistance to flow, leading to risk of clots. So viscosity shouldn't be high. If it is high, it will lead to resistance and then blood clotting. So let's go to objective number 2. It said to state the common examples of molecular phenomena. So we're looking at some molecular phenomena and their relevance in nursing. The common examples of molecular phenomena include diffusion, spread of oxygen in the lungs is an example. Osmosis, movement of water into and out of the cell is an example. Surface tension, formation of alveolar film in the lungs is an example. Capillarity, movement of blood in the marrow capillaries is an example. Active transport, absorption of nutrients in the intestine is an example. Evaporation, cooling of skin through sweating is an example. So as a form of summary, diffusion Kinetic theory: particles move randomly from high to low concentration due to thermal energy. Oxygen diffusing from alveoli, high oxygen pressure to capillaries, low oxygen pressure driven by particle motion, not chemical affinity. This is how it relates to nothing. Osmosis. Osmosis can also be understood as fluid dynamics. When water moves across permeable membranes due to pressure gradients, such as osmotic pressure in force per area. So, how does this relate to nursing? Water flooding red blood cell in hypotonic IV fluid is caused by imbalanced hydrostatic pressure, not salt attraction. So, water will move to area of greater concentration. So they will move away from low concentration towards areas of high concentration, not as a result of salt attraction. That's what that explains. So surface tension is another phenomenon. How does it relate to physics? Fluid mechanics. Coercive force at liquid-air interface creates a skin resisting deformation measured in newtons per meter. As it relates to nursing, the alveoli collapse in preemies. High surface tension creates excessive inward force. This is explained by Laplace law, which states that osmotic pressure is equals to 2 times your surface tension divided by the radius, the distance between the surface of flow. Capillarity. Capillarity is described as adhesion to cohesion in physics. Liquid rises in narrow tube when adhesive force is greater than cohesive force. This is governed by Dewey's law. For instance, your capillary tube is the principle that guides fluid flow in the capillary tube. Example in nursing practice: blood weakening into glucose test strip. Adhesion to paper fibers overcomes water's cohesion. This is the principle that works with your glucometer strip as you put blood samples on it and it flows to read the result. This is the principle that is being put in place. These are physics phenomena. Osmosis isn't water chasing salt, it's water moving due to pressure differentials. Diffusion isn't spreading out, it's Brownian motion driven by thermal energy. Okay, objective 3. Objective 3 says to describe the state of matter. The states of matter. As we all know, state of matter are as follows. Solid. Solid are fixed shape and volume. Particles are tightly packed. Example is your bone and your surgical instrument. Liquid is another state of matter. They have fixed volume but no fixed shape. Particles move more freely. Example is your blood, urine, and IV fluid. Gas. Gases has no fixed shape or volume. Particles are far apart and move freely. Example is oxygen, carbon dioxide, and anesthetic gases. As a form of summary, we look at the states of matter, their physical property, and their nursing application. Okay, we are looking at solid, right? Solids. Physics property. What is the physics property for solid? Particles vibrate in fixed position with low kinetic energy. Shear modulus resist deformation. Bones are examples. So, bones have high shear modulus, which prevents deformation under force. Nursing link. Fractures occur when applied force exceeds elastic limits. Liquid is another state of matter. What are the properties in physics? Particles slide past each other. Viscosity resists flow, which means that viscosity is equals to shear stress divided by shear rate. Blood is an example. In blood, viscosity is higher in dehydration, leading to increase in resistance to flow. That's Poisson's law. Flow is inversely proportional to 1 over viscosity. Nursing link. Monitor for clots in polycythemia. The last state of matter is gas. Physics property of gas. Particles move chaotically at high speed, pressure, and pressure equals to force over area from collision. How does it relate to nursing? Oxygen therapy. Gas flow depends on pressure gradient. So gas flow depends on pressure gradient. Example, your nasal cannula. When nasal cannula fixed on a patient 1 to 6 liters per minute, it will create a form of pressure to overcome airway resistance. Objective number 4, we will explain the concept, which are as follows. We'll explain surface tension, we'll explain osmosis, we'll explain capillarity, we'll explain active transport, we'll explain diffusion. Surface tension, osmosis, capillarity, active transport, and diffusion is what we want to explain. Surface tension occurs when the cohesive force at the surface of a liquid cause it to behave as if covered by a stretched elastic film. Please take note of the definition. Example, formation of water droplets, surfactant reduces surface tension in the lungs to prevent alveolar collapse. Osmosis, the movement of water molecules across the semi-permeable membrane from a region of low solute concentration to a region of high solute concentration. Example, water balance in cells. Capillarity, the ability of a fluid to rise or fall in a narrow tube due to adhesive and cohesive forces. Example, blood moving through fine capillaries. Active transport is the movement of substances against their concentration gradient using energy such as your ATP, right? Example, sodium potassium pump is in nerve cells. Diffusion is the next. Diffusion is the movement of particles from a region of higher concentration to a region of low concentration until equilibrium is reached. Example, oxygen diffusing from alveoli into the bloodstream. As a form of summary, we'll be looking at the concept, we'll look at the physical explanation and then nursing analogy. Concept, physics explanation, nursing analogy as a form of summary. Surface tension, the force per unit length at liquid air interface due to unbalanced cohesive forces. Nursing analogy, like a stretched rubber sheet in alveoli, high surface tension creates inward pressure. Osmotic pressure equals to 2 times your surface tension divided by radius. So when somebody is finding very difficult to breathe, right? Especially when there is an issue with the lungs, surfactants are usually added, and what surfactants do is that surfactants will then reduce the risk of lung collapse. Okay, so osmosis, as explained in physics, is net water movement due to osmotic pressure gradient. A colligative property. A colligative property simply means that osmosis depends on particle count, not the type. So it depends on areas of high concentration, not areas of salt. So how does it relate to nursing? Water moves to equalize pressure, not saltiness. Hypotonic IV fluid will lead to decrease in osmotic gradient or osmotic pressure gradient in blood, leading to making water to enter the cell, and when water enters the cell, it will lead to hemolysis. Capillarity is the height liquid rise according to physics. Height equals to 2 times surface tension cos theta divided by density, gravity, and your distance between the capillarity flow. Okay. Blood rising in test strip is an example. The reason why blood rises in test strip is because of adhesion. When you connect your glucometer strip into the sample, into your glucometer, and you put it at the tip of the blood to collect the blood sample, the reason why it flows to give you your result is because of adhesive force, and its adhesive force is usually greater than cohesive force. Wider strips will reduce the height, and that explains why lancet depth matters. So it is very important for you to prick deeply when you want to collect samples, as it may affect the rate at which samples flow. Okay, active transport is work done to move particles against pressure gradient. Work done is change in pressure times volume. It requires ATP and mechanical work. Okay, for example, your kidney pump do work against osmotic pressure. Diuretics will reduce the work done by the kidney, leading to increase in urine output. How does diuretics work? They reduce the work done by kidney pumps so that more water will be released from your body. That is an example of active transport. The next is diffusion. Fixed law. Diffusion is fixed law, which states that flux, which is the rate at which a substance moves from one place to the other with relation to time, is equals to negative diffusion gradient times concentration gradient. Okay, how does this apply to nursing? Oxygen diffuse because of concentration gradient. If there is no concentration gradient, oxygen will not diffuse. For instance, thick mucus will increase diffusion distance, leading to decrease in flux. Substances will not be able to move from your nostril down to your body, and this could lead to hypoxia in cystic fibrosis. Now, for instance, if somebody's nose is congested, right, it will make it difficult for air to flow to vital organs, and this could lead to hypoxia. Shortage of oxygen in the body. So, objective number 5. We'll be discussing the application of surface tension, osmosis, capillarity, active transport, and diffusion to nursing. Surface tension, for instance, surfactant used in neonatal care prevent the alveoli from collapsing in premature babies. Premature infants lack surfactant. It will lead to increase in surface tension. When there is increase in surface tension, it will lead to the collapse of the alveoli by respiratory distresses. So what we need to do is to administer synthetic surfactant, which will reduce surface tension and lead to decrease in osmotic pressure needed. When this happens, alveoli will stay open. Okay, surface tension also helps in cleaning of wounds. Reducing surface tension will improve penetration of antiseptics. Okay, physics principle. The physics principle applied in wound cleaning and surfactant for neonat is called the Laplace law. Okay, smaller alveoli require higher pressure to stay open. Smaller alveoli of babies require higher pressure to stay open. Nursing application. Surfactant reduce surface tension by 30 times. A measurable force change, not a chemical reaction. Application of the above. Okay, let's continue. Osmosis. Application to osmosis to nursing. Application of osmosis to nursing. IV fluid administration. Isotonic, hypertonic, and hypotonic solutions. Management of dehydration and edema. Physics principle. Osmotic pressure, right, is equal to IMRT. A pressure force driving water flow, dehydration, and edema. Okay, we can see what I is. M is molarity, R is gas constant, and T is the temperature. Osmotic pressure describe what happens in edema. So edema is simply water flowing as a result of osmosis, right? Nursing application. Hyponatremia. Hyponatremia, when sodium ions in the body is about 120 milliequivalent per liter, equimoles per liter. What do we do as nurses? Use 3% normal saline. Hypertonic solution will lead to increase in osmotic pressure in blood, leading to the pulling of water from the brain cells, leading to a decrease in cerebral edema. So the brain is swollen as a result of fluid going to the brain. What we'll do is apply 3% of saline, which is hypertonic, not hypotonic, right? It's hypertonic, so 3%, not 5%. 3% normal saline is hypertonic, and that's what we need for cerebral edema. Action: avoid hypotonic fluid in traumatic brain injury. They will reduce blood capillarity, leading to water entering the brain and leading to increase in intracranial pressure. The next phenomenon we'll be looking at is capillarity. Blood glucose test strip rely on capillary action. Fluid movement in narrow blood vessel affects perfusion. Okay, so these are all capillarity in practice. The nursing application of capillarity Number 1, blood glucose monitoring. Capillary action draws a small drop of blood into the narrow channel of glucose test strip without the need for suction or pumps. Number 2, wound drainage and dressing absorption. Capillary action helps move wound exudate or fluid from the wound bed into absorbent dressing. Example, gauze or hydrocolite. Active transport is another phenomenon. It is vital for absorption of essential nutrients, e.g. glucose and amino acid in the intestine. Maintains electrolyte balance in cells. Sodium-potassium pump is an example. Physics principle. Work equals to change in osmotic pressure times volume. Energy required to overcome pressure gradients. Nursing application. Furosemide, Lasix, blocks sodium pumps in kidneys, reducing work needed to move sodium. This will lead to decrease in osmotic pressure for reabsorption, leading to increase in urine output. That's how furosemide works. Action. What we need to do at that time is to monitor for hypovolemia. Reduce fluid volume will lead to decrease in hydrostatic pressure, which will lead to decrease in perfusion. Diuretics reduce mechanical work in jolts, which the kidney perform. That's how diuretics work. Diffusion is another phenomenon. Oxygen and carbon dioxide exchange in the lungs. Dispersion of anesthetic gases during surgery. Principles in physics. Fick's law. Flux is inversely proportional to 1 over the distance, squares of the distance. So doubling diffusion distance will reduce flux by 4 times. Nursing application. COPD patients. Thick mucus will lead to, when thick mucus increases in COPD patient, it means that the diffusion distance is increased. This will lead to decrease in oxygen flux, leading to hypoxia. I've explained that before. What should be our action? Use humidified oxygen. Humidified oxygen will reduce the mucus viscosity and also reduce the gap or the distance between the cells, right? Leading to increase in diffusion flux. Oxygen saturation depends on diffusion distance, not oxygen affinity. Now, for the circles of success, red circles tells us that these areas will be applied, these areas are needed for your examination. So what are they? Application of or relevance of physics to nursing. So take note of application or relevance of physics to nursing. Go through objective 5 again. Objective 5 is very important for your examination. So guys, I want you to answer these questions in the comment section. Why is understanding of osmosis critical when administering IV fluid to a dehydrated patient? How does diffusion explain the effectiveness of transdermal medication patches? Why must nurses consider surface tension when caring for premature infants with respiratory distress? How does Brownian motion impact medication preparation? Why is understanding vapor pressure important in oxygen therapy? So go through the options, choose the one that is correct. Let me know in the comment section so that we can discuss them. Thank you for your time. In case you've not subscribed to this channel, kindly click the subscription button and turn on notification bell so you get subsequent video like this for physics 112 as it relates to nursing practice. Thank you for your time.